Welcome to Saving Lives in New Jersey with the COVID-19 vaccine, a town hall presented by the New Jersey Department of Health. This evening, I'm joined by three wonderful physicians who are going to talk to us and answer questions about the COVID-19 vaccines. So I'm going to have each of them introduce themselves and tell us a little bit about themselves. Irini, could you start?
Yes, thank you very much. I'm Irini Daskalaki. I'm a pediatrician and pediatric infectious disease physician. I work currently for Princeton University, leading the public health response for university health services. But the views and opinions I express here are purely my own.
Thank you. Tamara.
Hi, I'm Tamara Green. I am an emergency medicine physician and a George Washington Health Policy Fellow, and I was born and raised in Newark, New Jersey. So again, the views and opinions expressed here are my own.
Thanks, and it's good to have a Newark person who, even if you went away for a little bit.
A little bit, yeah.
And Hafisa.
Yeah, so I'm Hafiza Sheikh. I'm a cardiologist in South Jersey, and I represent the Cherry Hill Free Clinic, and as well as the Community SJP Board. So thanks for having me.
Well, thank you all for being here. And let's start out by, I know that all of us have been vaccinated. So let's start with what our experience was when we were vaccinated. And I have to say for myself, I was very excited to be able to get the vaccine. I didn't know what was going to happen as far as side effects, but you see I have gray hair, which means I'm a little older, and I had very minimal side effects. I did have a sore arm, but not much more. And even after the second dose, I had very few side effects. But I was very excited because I feel very much protected after that vaccine.
It was kind of the same for me. I was a little bit nervous because I also had COVID in the beginning of the pandemic. Me and my husband had COVID, so we were a little bit nervous because of potential side effects. The fact is, we didn't have much of anything. I had a sore arm with the first dose, even less of a sore arm with the second dose. My husband maybe had, a little bit of a headache. That was about it. I can also tell you that my entire team has been vaccinated, and the next day we all worked full day, and we had really no problems.
Terrific.
That's great to hear. Yeah, so I had a similar experience probably to your husband, Irina, where I did have a little bit of a headache, a little bit of chills the next day. The day of, I felt totally fine. I didn't feel a thing really. But the next day, I felt a little bit of that. I did take some acetaminophen, and I felt totally fine to carry on my day. So thankful for that.
I had a similar experience as well. The first vaccine shot that I got, I didn't even feel it really, and I kind of looked at my arms like, did I even get anything? Because it was so quick, and I didn't have any symptoms. But the second dose that I got, I was more achy, had a temperature up to 99. Nothing bad. Like if I had to go into work, I probably could have, but luckily I was off that weekend. But kind of powered through, took some Tylenol like the second day, and by the third day, no problem.
Fantastic. There's a lot of misconceptions out there about the COVID-19 vaccines. Irini, what do you think the most common ones are?
Yes, I think you're right. There are a couple out there. I think one important one is that the vaccines were developed too fast, that somehow there were corners that were cut, and that's why we have vaccines now. And this is not true. And we can talk a little bit about how that transpired. First of all, we're dealing with a pandemic, and we had kind of a situation where all hands on deck, where the scientific community, the government, like many agencies, all, came together for this one goal. So, and we can have amazing results when we do that. Also, for some of the vaccines, the mRNA technology, this technology has been studied and reviewed for over a decade now, and it was just a prime opportunity for this kind of vaccine to be developed, and it's exactly a technology that allows us to develop vaccines very quickly. Also, for the specific virus, the coronavirus, we had a little bit of a leg up because of previous coronaviruses that the world had to deal with, like the SARS-CoV-1 and the MERS-CoV. People had tried to understand them better and if we would need to make a vaccine. So we had a little bit of, like some groundwork that was already done. So the companies that they had to develop the vaccines, they had advisory boards that they were, submitting the results. And then once, they were ready to submit the results, they had to go through a very rigorous scientific process through the FDA and then the CDC and the Advisory Committee of Immunization Practices. So they have gone through a very rigorous scientific process, these vaccines, to come to us, and they are still being reviewed very rigorously.
Excellent. Tamara or Hafiza, are you hearing any other things that you want to comment about?
I'll go. I've heard that people are concerned that once they get the vaccine that they won't get COVID, and we'll probably talk about this a little bit later as well. But the goal of the vaccine is really to prevent severe disease as well as death and hospitalizations. And we know that, like Dr. Irini mentioned, that given the safety profile of it, we've seen a decrease in severe disease coming through hospitals with hospitalizations, as well as when patients present and then are sent home. So we know that it is working. It may not be 100%, as no vaccine is 100%, but we are seeing some decreases in the severity of disease as well as the number of deaths compared to what we were seeing in the beginning prior to the vaccine.
Tamara, that's great. I totally agree with that. I think one of the other misconceptions that I've heard too is just that the side effects are so terrible, or, what is it going to do to me? How will I feel later? But the side effects that are created by the vaccine, they are really artificial. So basically it's creating and mimicking this situation so that your immune response reacts to it. So the response that your immune system has is real and that's intended, but it's an artificial sort of reaction. So I just want to keep that in mind, that it's not as dangerous. It's not the same as having the virus itself or anything of that nature. So, and it is short-lived and self-limited. Most people feel nothing from the vaccine either right away or at least 24 hours afterwards as well.
Thanks. Tamara, do you think there's a reason why the regular public is not given an opportunity to select which specific vaccine that they would like?
I think because of how deadly the virus was and how fast it spread, it was kind of like we mentioned before, all hands were on deck coming up with the vaccine. I'd say the U.S. has been in emergency mode really for the last year and a half. So now it's a miracle that we have the vaccines that we do. So the best vaccine for anyone right now is the vaccine that they can get in their arm.
Agree with you entirely. A lot of people wonder if medicines that they're taking might somehow interfere with the vaccine, or if they should stop taking their medicines. What do you tell them, Hafisa?
A good question, and I have definitely gotten that question quite a few times from my own patients as well. But fortunately, this vaccine in its different forms does not interact with prescription medications or other medications. They will not reduce the efficacy of the prescription medicines that you're on. So certainly always discuss things with your primary provider as well too, but no medicines need to be stopped before taking the vaccine.
Excellent. What if someone was on steroids or something that would suppress their immune system? Would that be maybe the exception?
It's a good question. Steroids can alter the immune response to things, especially to other illnesses that can be contracted. But again, because the vaccine is this artificial reaction, to the best of my knowledge, that's not something that should be interrupted. And certainly with steroids, as with all medicines, definitely do not interrupt them without consulting with your provider as well, because there actually can be other repercussions for stopping a medicine abruptly, especially steroids.
That's great advice. Thank you. Irini, is there any evidence that the vaccines reduce transmission of the virus other than through reducing symptomatic infections?
So there is actually mounting evidence that the vaccines are reducing all infection, not only symptomatic, but also asymptomatic infection without symptoms. So by reducing all infection, it does reduce the transmission. I think the studies are still happening, and the jury is still out about how effective are the vaccines for asymptomatic infection and transmission. But all the clues that we get are that actually the vaccines will probably be very effective for stopping the asymptomatic infection and therefore transmission.
Which is really great news. Fantastic. I'm going to ask, Tamara, I'm going to ask you to look into your crystal ball and tell me whether you think that New Jersey schools or New Jersey employers or other people are going to start mandating receipt of the vaccine. What do you think?
I don't think we should be worried about mandates on a grand scale just yet, but I do know that Rutgers is mandating vaccines for their students returning to campus in the fall. As far as for elementary schools or middle schools, high schools, it'll probably be up to school boards as well as parent-teacher associations to decide on that.
I have heard that there are some companies that are thinking about mandating the vaccine so that they can get their employees back in for in-person work. So it'll be interesting to see how that evolves over the time. And I like your distinction between colleges and grade schools and high schools, because certainly on colleges there's the whole deal of campuses and congregate living and
right.
Dorms, and the opportunity for transmission in that setting is a whole lot higher. We know that in K through 12 school, there actually is very little transmission of the virus. So I agree with you. I think even if colleges do mandate it, that won't necessarily go over into the K to 12 schools. But it'll be interesting to see. Afiza, do all of the currently available vaccines protect against the numerous variants that we keep hearing about?
So as far as we know, each of the vaccines that are available, they do provide coverage for at least some of the variants. The more challenging part is the variants themselves. That's a moving target, and that's something that's changing. So that's why it's hard to kind of give a complete answer there. But for sure, each of them do certainly cover a certain amount of the variants. It's just that, what's coming in, especially to the United States, we're not totally clear on, and I think that's going to be a moving target. But I think we'll definitely have some more opportunity to learn about that in the future from the companies that are researching this.
Thanks. Now, we got a question about integrating zoonotic diseases such as COVID into New Jersey's newly formed One Health Task Force. Tamar, can you tell us a little bit about what that's all about and what that group is?
From what I've seen, the One Health Task Force is a collaboration between healthcare providers, veterinarians, as well as other interested groups to kind of monitor certain diseases. So typically or historically, we would think like rabies or something spread like salmonella or other diseases to that effect. So this is a way for the state of New Jersey to kind of bring some of the best minds together in those areas and kind of break down silos, share information and collect data, and I guess very likely help for the next outbreak should it come.
Absolutely. I'm going to shift gears a little here. And Irini, can you tell us why the vaccines are recommended for people who have already had the disease? So why did you get the vaccine? You already had the illness.
That's right. So there are lots of things we don't know about the immunity after the COVID disease. And we don't really know how long it lasts or how robust it might be according to, how severe was the disease or not. These are all things that we're looking into. But it is highly recommended for people who had the disease to actually get the vaccine, because the disease might give you very short-lived immunity. We have seen that maybe the first month or 3 months after the disease, you may not be infected, but the infection is possible later. And the protections of the vaccines, you can get protection from the vaccine. So it is recommended for everybody who had COVID to, receive the vaccine as well. Now, if somebody who had COVID had these treatments with monoclonal antibodies or convalescent plasma, that might interfere with how the body and the immune system responds to the vaccine. So they may have to wait a little bit longer in order to get the vaccine.
So from your answer, I take it we really don't know how long your protection will last after natural disease.
That is correct, and we don't know exactly how long it lasts after the vaccine, because we have we have some months under our belts for now, but there is some evidence that the natural immunity is not as robust or as standard after everybody who had it. So we expect a more standard response, I think, with the vaccine.
And of course, we have to think about these variants. We know something about the ones that are currently here, but we also know that every day, every week, new variants are coming up, and we don't know what will happen with those variants. So we don't want to take any chances here. We want to try to protect everyone as much as we can. Now, there have been some of our patients who are a little reluctant to get the vaccine. So I'm wondering if all of you can tell me what your strategy is. What do you tell people in New Jersey about what do they need to know to really reassure them and to counter any hesitancy or that kind of desire to just wait and see? So Tamara, can you start us off?
Oh, sure. I think at this point, because of the number of people who've gotten vaccinated so far, it's easy to find a friend or a family member who has been vaccinated and kind of ask them, so what was it like? Did you have any side effects? But I think it's also important for states to continue to work with community-based organizations as well as churches to reach out to those communities that don't always have the best access to care in general, and just to be available to provide vaccines for them. And I think it's also important for us to not just focus on getting back to normal, but kind of thinking about what we want our future to look like, what our better future would look like, and what that means to us. And really, vaccines are the way to get there. It's really part of the plan, as well as continuing to wear masks and wash hands and things. But I think if people really want to have a better future, then I think they really need to consider getting the vaccine. But it's healthy to want to have questions, so definitely talk to friends, family, clergy members.
And how about for the people who come to you, Hafisa? What do you tell them if they're asking you, they're really not sure they want this vaccine? What kinds of things do you use to kind of help them make that decision?
I try to educate them on the fact that the virus itself it proves a really imminent threat just because of the fact of how it can transmit between people that are even asymptomatic. That makes it very dangerous. Just the fact that we don't even know a lot about even some of the long-term side effects of the virus and what it's doing. So there's a lot of unknowns, there's a lot of dangers in that situation. But on the other hand, we do have the opportunity to potentially provide good protection to the whole population. We have the opportunity to provide that security, maybe enable people to be traveling more often in the future and be able to interact with each other. And I hesitate also from saying, getting back to normal, kind of like Tamara had alluded to as well. But, it's more of a matter of, hey, can we at least facilitate getting closer to what normal looks like? But again, having that immunity and having that herd immunity is what's going to help us get us there eventually. So the risks are very little of the vaccination, but the risks of the virus are very serious.
Irina, do you have any other tricks that you use?
I always say to people to look into trusted sources for their information. I think there is a lot of misinformation out there, and to consult with the healthcare providers or other trusted source of medical information. And if they have questions about understanding their own, risk-benefit ratio when it comes to the virus. I think most of the time it turns out that people have, much greater risk of acquiring the disease and being very sick from it than, having, any side effects or any issues from the vaccine. Look for themselves around this, risk-benefit ratio.
Absolutely. So one of the questions that I sometimes hear is, well, what if I don't know that I'm infected and carrying the virus and I get vaccinated? Is that going to cause me any harm, Irini?
The vaccine, the way it works is once we get it in our bodies, is starting working and producing antibodies, but we don't get the full protection for probably the first 2 weeks. So we're considered fully vaccinated after the last dose and 2 weeks after this last dose. So if we have acquired the virus before or right after we receive the vaccine, there is a possibility that we're going to have disease and that we can get sick. And it's not going to be considered like what we call a breakthrough case. It's not going to be like a failure of the vaccine. It's just the vaccine did not have the time to give us the immunity. Now, how sick we're going to be and if the vaccine will give us a little bit of protection, I think it's a matter of timing, of like how quickly our immune system will be able to mount a response. But they have already, had the virus. So I think it's a matter of timing. There is no evidence that it's going to harm us, though. Like the vaccine will harm somebody who has already been infected with the vaccine, with the virus, very recently. So that is, I think, reassuring. And that's why it's not recommended to have, let's say, a test just before getting the vaccine. We don't need to do that.
Well, what if you have symptoms? Should you go get the vaccine so that you could maybe change the course of your illness?
I wouldn't recommend that. I wouldn't recommend anybody with symptoms to be, out in public. I think as a society, we need to do a better job of, realizing that when we have active symptoms, we really need to, self-isolate and not expose other people to whatever it is that we might have. So we don't want people to go with active symptoms or with an active COVID infection. If they had a positive test, for sure they have to clear isolation first, which is usually 10 days, and their symptoms need to be improving, their fever, breaking and all these things. We don't want people with active infections as their immune system and very symptomatic infections to be vaccinated and go out.
And then it's probably okay for them to wait a while since they're going to be immune from that active infection. So there's no real rush to get the vaccine right away, although clearly we would like them to get the vaccine eventually. Did I say that correctly?
For sure. We think that for the first 3 months after a positive test or a COVID infection, we have enough immunity that we are not getting reinfected.
Fisher, can you tell us a little bit about people who have chronic conditions, things like either diabetes or chronic cough or heart failure? Should they really be getting this vaccine? Is it going to be a problem for them?
They are actually the most important people that should be getting the vaccine, just because what we do know is that a lot of, medically referred to as comorbidities, which is the presence of chronic illnesses, unfortunately does add to the chances that you could have a more complicated course of recovery from the COVID infection. So for sure, people who have things such as insulin-dependent diabetes, type 1, other chronic illnesses, they should be encouraged to have the vaccine. They should be first in line, in fact, too, just because we know that they'll get the best benefit. One question that comes up too is people that have a chronic cough, for example. So if you have a chronic cough, then that's less likely to be COVID, obviously, should be evaluated again by your physician, and certainly with a cough, depending on the other symptoms that could or could not lead to being tested for COVID as well with your physician. But otherwise, if it's a chronic cough and the absence of, an active infection, then definitely you should also be eligible for the vaccine and should be able to get it.
Tamara, at the beginning of giving the vaccine, there was a lot of sort of discussion. Does this really prevent you from getting infected? So do we know now? Do we know anything more now? Does it really prevent you from getting infected or just getting sick?
There does seem to be some evidence that it prevents severe disease, obviously, and then there's been decreases in severe disease as well as death, as well as hospitalizations. Again, no vaccine is 100%, so it's probably not going to prevent everyone from getting COVID, but the hope is that, again, that it will decrease transmission rates as well as decrease hospitalization and severe disease and the number of days people have to spend in the hospital.
Well, that's certainly worth getting the vaccine, because all of those things are things we would like to prevent. Irini, when do you think children under 16 will be able to receive a vaccine?
I think we're going to have good news for that soon. There are several companies and manufacturers who are having trials for children 12 to 15 years of age. And I think, in the next few months, we may have, like some vaccines that will be available to this age group.
Fantastic. Certainly, we think that to get up to that certain percentage of people vaccinated to protect the whole community, we're probably going to have to include children, because children are about 25% of our population. So in order for us to get community protection, we're really, it's likely we're going to need to protect them as well. It's good news that they aren't getting so sick, but we do know that they can spread the virus around. So they're not the major spreaders, but they too can take part. It's an egalitarian virus. It really seems to get and bother almost all of us. Are there any particular side effects that are more significant or more likely in people who have underlying chronic disease? Afisa?
Yeah, so there definitely are some kind of long-term side effects and short-term side effects that we have been seeing from the viral infection. In terms of the short-term effects, definitely, obviously, there's a decent course of fatigue and cough and respiratory symptoms that are happening, in addition to even some gastrointestinal symptoms that are going on as well. What we are finding is, both in the short term and long term, from a cardiology standpoint, there are unfortunately a fair amount of people that are having serious cardiac side effects and strain on the heart, for example, that's been happening. There have been even some more, rare cases of very serious cardiac complications, and unfortunately very ailing people from that as well, that require really advanced cardiac measures as well too. And even then, we've been struggling to stay ahead of the effects of the virus. So, I think to fully answer that question, Tamara, do you still have that crystal ball that you were referring to that Meg was offering you? Because, I do think that the other thing with this virus is just that we're learning something new every day. And I think that's really the frightening part, because anything that's unknown is really what can be frightening for us. So while we know some of the organ systems that I mentioned that are being affected, we're still learning more in terms of this every day. There's another aspect too. There's a pocket of people who've recovered from the virus called the long haulers as well. So what that means is the long haulers are people that are even months after recovery from the viral infection are still having persistent problems. And this could range from things such as fatigue or brain fog, which unfortunately there really is no better terminology for that. And even just shortness of breath that's lingering, people that require oxygen for an extended period of time as well too. So there's a lot that's going on, both short term and long term, and just hoping that we'll see a better resolution to this soon enough. And that resolution comes with obviously being able to protect ourselves, protect our family and loved ones, having these conversations, and being able to make sure that more and more people are protected and vaccinated every day.
Now, those long haulers, there's been some discussion as to whether they should or shouldn't get the vaccine. In your opinion, do you think, we've heard stories of how some people feel instantly better after they get the vaccine, and others really it doesn't alter the course. How do you talk to those people with those long haul kind of symptoms, and what do you advise them as far as getting the vaccine?
I don't think there's a correct answer to that, but I'll definitely give you my speculation on that, which is that even though the symptoms from being a long hauler can linger for some time, it doesn't necessarily guarantee that your immunity is going to linger for the same duration of time. So in that situation, for example, if that was me, I would say that I still want my immunity, I still want my protection, because God forbid I do get infected at some later point because my immunity from the original virus has now disappeared. I would definitely want to be protected, so that way I wouldn't be at risk of an infection again. And certainly if it was that significant the first time around, there's no telling what it could be like the second time around.
Good advice.
Just to add to that, I think it's been interesting that we've seen even children and young adults who previously haven't had any underlying disease become a part of the long hauler group that Dr. Hafisa was talking about. So I think that, again, that speaks to the importance of getting the vaccine and getting protected for that immunity, like she said.
Yeah, it's interesting. The other thing we've seen in children is this multisystem inflammatory syndrome, and some of them have had heart involvement and long-term heart problems. What would you advise a child who's recovered from multisystem inflammatory disease? What do you think, Irini?
Yeah, that's a good one. We don't have any data truly to know what exactly to do, but similarly to the answer for the long haulers and the people who had like severe disease from COVID, I don't think that we want anybody to have to go through COVID again if they had like such severe disease. So I think I would err more towards saying that it's better to have the protection and the immunity. But I would really like to see, like once the vaccine is available, to this age group, like more data as well.
Yep, and hopefully that will be relatively soon. Yep. Well, one thing we've seen in New Jersey, I mean, the good news is that in 4 months, we've administered close to 6 million vaccines, and we have over 2 million people fully immunized. So, we're getting there, but now we're I think beginning to see even more that not everyone's, coming forward to get vaccinated. And one of the great concerns in New Jersey has been that the vaccine distribution has not really been very equitable. We're still really lagging far behind among people of color, African Americans and Latinos and Latinx. Is there anything that we can tell them, or how would you recommend that we think about going into these populations and really encouraging them to get vaccinated? Tamara?
I think to target those populations may require a slightly different approach. I know that there's been success with church groups that have become sites for vaccinations. I know that there's a group out of Philadelphia vaccinating certain neighborhoods, and they leave at least half of their vaccine slots open for walk-ins, because a lot of times people don't have the access to the computer or the mobile phone or the technology available to get an appointment. So I think it just may take a certain mind shift with local and state governments to kind of continue to work on those community partnerships, as well as thinking, hey, these are certain populations that they're working all day. They might not be able to get to an appointment or a mega center, or they may not have transportation to a mega center. So looking at some very active like church groups and community-based organizations, as well as maybe considering walk-in hours for certain neighborhoods may really increase the number of people that get vaccinated.
Yeah, I just wanted to add on to Tamara's recommendations, which are excellent. I think that especially in our area in South Jersey, the Cherry Hill Free Clinic that I volunteer at, they've also been granted the ability to hopefully be administering. And so that's great, just because, again, sometimes the insurance coverage can be a barrier, just access to healthcare in general can be a barrier. Sometimes I think there's also, language barriers that can come in the way too. So I know that the Cherry Hill Fruit Clinic also tries to work through that as well too, to try to expand access to care. In our region also, the virtual healthcare system has been reaching out and having individual clinics and partnerships with churches, like Tamara mentioned as well too. And I think that's been really helpful, just because going on site, I think it makes it a more comfortable experience for people. And this way they can also discuss it with other people that they feel familiar with and may feel more relatable. And it's an opportunity to ask questions and understand that the vaccine is safe, it's available. We need to take advantage of it just to make sure that we are protecting not just ourselves, but everybody that we interact with and everybody that we are around. So I think those initiatives are wonderful. I've seen a lot, and I hope they keep continuing to go on.
Yeah, I think the Department of Health has set up a lot of the pop-up clinics, just as you mentioned. So several of the churches have really been very helpful in talking to their congregations and about the importance, and actually as being a vaccine site where
Right.
it really was what we call a closed area, so a closed pod or closed point of distribution, where the only people who could get vaccine in that area were people from the community or from that congregation. And that has made a big difference. In Newark, where we targeted certain zip codes, we've also seen a dramatic change in the number of people that we can get immunized. So I think all of those outreach things are definitely going to be very important. So as we sort of come to the end of our program here, let me ask each of you to kind of give me some closing thoughts. What do you want our audience to know about these vaccines, and what's your advice to them? Irini?
Yes, I think the main advice is that we are very fortunate to have safe and effective vaccines that prevent severe disease and death from COVID, and probably prevent also infection and therefore transmission from COVID, and that we should all take advantage of that. And the end of the pandemic will be, it is more visible because of these vaccines.
Afisa?
I agree. And I think it was Tamara that had mentioned before too, that it was almost an emotional experience to be able to get the vaccine. So, early on when the pandemic just kept progressing, it made a lot of us think, how long is this going to go on for? Where is the end point? What's happening? And then when the vaccine came out, it was a huge sigh of relief. Is it 100%? No. Is it going to end the pandemic in a squash? No. But this is the gateway to us seeing an end to this and seeing a progress into the future. So I highly encourage it. I was first in line myself, and I try to also advocate to my patients as well too, that we have the opportunity, the option to do this. So we definitely do need to take advantage. I worry about, again, the access and the hesitancy. And I think some of that is just also a lack of information at times too. So I would say that if you are on the fence, or if you're not sure if you're a candidate, or if you're worried about interaction with your medications, whatever it is, just have an open dialogue. Have an open dialogue with, as Irini mentioned, a trusted source of information, such as your healthcare provider. There's always going to be someone around, around in your neighborhood, around in your workplace, who's going to say that they had a certain experience, but those are what we call anecdotes. They're not evidence-based medicine. Evidence-based medicine is what you can get from the trials and from the research and from discussing with your healthcare provider, so you can get an individualized answer. But don't be in the dark. Ask questions, have the discussion, put a call out to your healthcare provider if you're not sure, because I think the answer is there. I think the option is there, and we just need to all take advantage of it.
And Tamara, you get the last word.
Oh, great. No, I definitely agree with all the other panelists. They made excellent points. I think that the bottom line is this vaccine is, or the group of vaccines are our way to get on the other side of this. It's been, going on a year and a half. I've definitely seen a shift in, I guess, a hopeful spirit among my coworkers. Now that people are getting vaccinated, when you're in the middle of it, you're just like, how long is this going to continue to go on? So people are hopeful, and I know that people want us to get out of their house and travel and interact more, but vaccines are really the way to get to that. So it's really important to consider getting the vaccine, but as like mentioned earlier, find trusted sources, speak to people who have had the vaccine. You can even speak to people who've had the virus and say, hey, you know, it's a severe disease still with variants coming down the pike, and there's a lot of things that we still don't know yet. So this is just one way to protect yourself, protect your family, protect your friends, and kind of, again, work towards a better future for all of us.
Thank you.
Mm-hmm.
And I want to thank all of our panelists tonight. And of course, I want to thank all of you who are listening to this and who have submitted questions to us ahead of time. So if you want to learn more about the COVID vaccine in New Jersey, visit covid19.nj.gov/vaccine. Remember, we always stop these programs by reminding you, please continue to do all of the things that we've been doing for this last year to try to prevent spread of the virus. So please wear your masks, wear them appropriately, cover both your nose and your mouth, and keep those masks on. Don't wear them down around your chin. Keep your 6-foot distance from other people. I always talk about a physical distance, not a social distance. We want you to be socially connected, but we want you to do it at a physical distance to protect yourself from those droplets that spread the virus. Wash your hands, stay home when you're sick, try to stay away from sick people, try to stay out of crowds where it's much more difficult to do that physical distancing. And together, you know, we can bring this pandemic to an end. So thank you for watching, and stay safe, New Jersey.